Hello, this is Ellen Madono. Welcome to this introduction to Shahrdar cases and to Dr. Shahrdar, our teacher. I'm the manager of the website offering this free class, and if you'd like more information, go to these websites. I met Dr. Shahrdar in 2011 when he was presenting an internet course. And I was very impressed with this course, so I asked him to teach it on the web. Dr. Shahrdar is teaching homeopathy all over Iran and is certifying homeopaths there. This is just my impression, but he's a very gentle, very romantic soul, and he's brilliant. He kind of has no hard edges. When he presents his seminar, you get that feeling. And he's in love with neuroscience, but his presentation is very simple, so you just don't get that hard scientist part of him on just meeting him. The reason why I'm interested in this, what he's thinking, is because I have a very bad habit. I go shopping for rubrics with no plan. And I've learned that it's better to think before you jump and plan before you repertorize. And I've learned from Dr. Shahrdar that planning is a habit and it's a skill. You do it over and over again, you look at different kinds of cases, and you get better at planning. So the rest of this interview is adopted from an interview done by Dr Bhatia. Hahnemann meets modern science through Dr. Shahrdar. Dr. Shahrdar uses data from modern medical research, studies of infectious diseases. And he uses this data to describe miasms. Data isn't useful unless you have some method of analysis, and Dr. Shahrdar uses classical homeopathic analysis. What a miasm is basically what Hahnemann said a miasm is. Miasms are based on infectious diseases, and chronic diseases involve interrelated systems. That is, these are systems of the body. So there are multiple causes. Dr. Shahrdar likes these four terms: psycho, neural, endocrinal, and immunological images of an infection. So you're going to have all of these aspects in an infection that becomes miasmatic. It can be acute or chronic. If you have a pathology in any of these systems, usually they're chronic and they're serious. The source of the idea of miasm comes from the chronic diseases, which is a book by Samuel Hahnemann. What Dr. Shahrdar is doing is using updated epidemiological data. Little mistake there. Hahnemann's image of Sora is a hydra-headed Sora. So you see this dragon here with many heads. And each of these heads is a different disease. It's a kind of Sora then becomes a catch-all, a cover for many infectious diseases. It's not just one disease. This is a source of great confusion when you're trying to use classical miasmatic analysis, or at least it has been for me. Is a miasm chronic or acute? Dr. Shahrdar says miasms can be either. So in this course, we study both acute and chronic cases. Why does he use current scientific empirical knowledge? Why isn't Hahnemann good enough? Well, this data is more accurate and better organized. And you can use basic homeopathic analysis to analyze the symptoms of viral and bacterial infections. Dr. Shahdar's research doesn't include the funguses or prions or other sources of infection. He has organized this information into a software that he calls Repertorium Virosum. And this software contains a repertory and a materia medica. The software is not needed for the course. It's available in a PDF file, which is free. And software instructions is not the purpose of the course. The software is pretty obvious. It's like any repertory software. Basically, in this course, you'll learn when to use the software for miasmatic analysis. The reason why he's teaching strategy first is because you don't use the software for every single case. It's for certain kinds of cases. So what is this holistic image of a disease? Shahrdar, you have to go back to what Dr. Shahrdar did. He looked for the symptoms that best represent the disease. So the most frequent, the most intense, the most problematic, the ones of longest duration, the most chronic. I didn't include these here, but these kinds of symptoms of disease become the rubrics in the software. And this is the same method that we have for creating the images of provings of cases and for the materia medica. So Dr. Shahrdar was basically using Hahnemann's logic. Infectious disease, remedy, patients, proving symptoms, these all involve, they're related to one another because they're all similar. They all have the similar kind of image. So you're matching disease symptoms with the patient's symptoms. This is something everybody's familiar with. Hahnemann's hydra-headed sora is divided into multiple disease images. Sora is broken down, separated. So there are multiple diseases within the sora. So we use the Repertorium Virosum to separate these diseases. You learn to plan strategies for simple cases. This course is not about complex cases. Complex cases is a level above this course. We are using classical homeopathic analysis. You always do the classical analysis first, and then when you lack distinctive symptoms, when you lack symptoms that will identify the remedy, then you go to the miasmatic analysis. Then you go to the software or to the PDF files. Of course, the use of a computer software decreases the confusion of miasmatic theory and its clinical application. And because there are multiple miasms in a single case, a case can be very complex. Okay, but we're not going to be studying those cases. Now, viruses cause many systemic infections, and rather than talking about bacteria, viruses are the ones that are shown to cause degenerative nerve disorders, many different kinds of diseases. I think I've left out cancer and other kinds of diseases that are thought to caused by viruses. And viruses are particularly virulent. They're very strong because they can be, they reproduce themselves by entering the cell and taking over the cell's DNA. And this process helps to explain why miasms are inherited. The current symptoms in any case are the active miasms. Usually there are at most only 2 active miasms in a case at any given time. The homeopathic idea of latency is different than the medical idea. Okay, so the medical idea would be that the latent symptoms are just simply not visible. So you don't see the symptoms of herpes simplex, um, and that's called a latent medical disease. It comes and goes. But the homeopathic definition is different. Okay, this is another subject. Nosodes to Dr. Shahrdar are just remedies. You use them when they match the case. And so you don't just take a lab report and with a disease name on it and assume that that means that that's the miasm. Just the same as you don't necessarily give influenza for influenza. So Dr. Shahrdar does not use nosode therapy. But the Repertorium virosum can be used to uncover latent symptoms. Latent symptoms have been integrated into the organism, so they differ from the original primary symptom. So the original disease symptoms become organized into the organism itself. And you don't have all of the symptoms, you only have some of them. And at this point, you begin to suspect miasmatic analysis is needed, but you're not sure. But always what's being taught in this course is first you do normal repertorization, and then you use the RV or the Repertorium virosum. Okay? Then you do miasmatic analysis. And just as an example of how powerful these viruses are, there's an ancient infectious disease called HERV, and it's 9% of our current genome. But this scientific finding lacks clinical research or clinical application. In latent forms, miasms are no longer contagious, so they're not the contagious disease that they were originally. And they affect both chronic pathologies and evolutionary development. As we said before, they also affect acute diseases or acute manifestations. Now, in closing, here's a quote from the Chronic Diseases by Hahnemann. Now, this is a little bit tricky. The 2 theys are different. So may they, later generations, do better with the great discovery herewith to them. And if they, this is Hahnemann's contemporaries, should not treat this discovery any better, well, then a more conscientious and intelligent posterity, so that's us, or Dr. Shahdar's work, will alone have the advantage to be obtained by a faithful, punctual observance of the teachings here laid down. So, if you do this kind of treatment, of being able to deliver mankind from the numberless torments which have rested upon the poor sick, owing to the numberless tedious diseases, even as far back as history extends. This great boon had not been put within their reach by what homeopathy had taught hitherto. For more information, please go to these websites, and I hope to hear from you in our course called The Second Time Shahrdar Cases, which is a free internet course.